The condition is known as preeclampsia. Over 70,000 women worldwide die from the condition every year, according to the CDC. Currently, there is no routine screening for it, but new research out of UW Medicine shows a promising way to predict it with a simple blood test. Preeclampsia typically emerges in the third trimester of a pregnancy,
but can present even earlier in some cases.
Dr. Raj Shri is an OBGYN and associate professor at UW Medicine's Division of Maternal Fetal Medicine. She says preeclampsia affects about 15% of pregnancies. While an exact cause is unknown, risk factors include women who have existing high blood pressure, diabetes, older age, and IVF pregnancies. Dr. Shri says there's no specific treatment for preeclampsia after it's established, which is why it's critical to get a handle on it before complications kick in. Complications from late-term high blood pressure can lead to kidney failure and early delivery.
That's the only way we have right now to initiate the process of sort of recovery or cure. And that, of course, means, higher chance of having a preterm baby.
Something moms and doctors want to avoid. But Dr. Shri's research recently published in the journal Nature might have a solution. A simple blood test to predict the chances of developing preeclampsia in early pregnancy. Doctors already examine DNA that sheds from the mom's placenta to screen for genetic disorders like Down syndrome. Dr. Shri figured, why not screen for preeclampsia at the same time?
And so we thought, well, since we're looking at placental DNA and we know that preeclampsia is really heavily related to the placenta and placental development and function early in pregnancy, could we sort of leverage that biology for this other indication of looking at preeclampsia risk?
She and her team sequenced what's known as free cell DNA samples from women over a 6-year period and developed a blood test that showed 80% sensitivity in predicting whether a pregnant person might develop preeclampsia. Dr. Shri says it beats the current screening procedure, which consists of going through a checklist of patient history.
Although easy to administer, lacks precision, I would say, in really identifying those who will go on to develop preeclampsia.
She's hopeful this new screening method could be more accurate. The next step is looking at more samples and getting approval to conduct clinical trials. The ultimate vision is for preeclampsia to be part of routine early pregnancy screening. For HealthLink, I'm Christine Pei reporting.